Good morning. uh, Going to start our morning class today. Today is, let me take a look at it here. Okay. Today is Saturday, uh, May the 8th, 2021. Tomorrow is Mother's Day. So advance, happy Mother's Day. This is our every Saturday morning regular class through Sattik Space Yoga and Healing Studio. Today's topic is very simple. Yoga therapy is simpler than walking. What it is that a lot of my friends were asking me, especially in this time of COVID-19, what they can do to improve their immunity and to fight this pandemic. My answer to them is very simple, is that if you adopt a relaxation response, you adopt and parasympathetic activation, and you will see that slowly and slowly your immunity gets better and better. All the practices we do, daily practices, is good, but what we recommend, that what is sustainable, is to adopt in your daily lifestyle and daily activities. Again, if you remember, last week we talked about that treatment of a chronic low back pain with our day-to-day activities. Today I'm going to talk to you and show it to you a little bit what can be done as a daily activity to improve your body's immunity and which we call our well-being. Generally, what we say that well-being is a balance of our physical, mental, and social wellness. And what we say that by unblocking or unlocking our inner healing power. Our body has the own healing power, own healing system, which you know the pathway is called psychoneuroendocrinology. Now, as you all know, which I've shown it to you multiple times, that our first and foremost, the daily lifestyle. The first daily lifestyle is called drinking a glass of water on a squatting pose. When you get up in the morning, we sit down in a squatting pose, drink a glass of water, and that water starts a peristalsis, and we get a very good bowel movement in the morning, which is primarily a sign of health. strong digestion, easy elimination, and good night, dreamless sleep are the sign of your health. Brush our teeth, or use a tongue scraper, clean the tongue. The moment you remove all the coating of the tongue, when you put a food in the tongue can sense the taste of the food properly. And based on the taste of the food, the tongue starts to do your digestive process. The digestion goes on, and when the food gets properly digested, it converts into 7 tissues. Then it converts into a substance which is our inherent body's immunity. Once you have a balanced immune system, that is yoga as a therapy. Washing your nose with a neti pot, we call it a gel neti, do it all the time. Following that, you can do your daily practices. But even first thing we get up, we want to tell you that exactly what we are doing in our daily life, that is incorporated in our yogic lifestyle. And this word came from, it's just simpler than walking. Actually, a friend of mine told me one day, he said, you practice yoga, especially asanas, that you start where you are. But you stay in the pose. Stay in the pose little longer and longer. The neuroplasticity sets in and the brain allows you to progress, to go into the next stage and next phase of that asana. And once you start the relaxation, you start having a powerful, voluntary, regulated breathing called pranayama. Once you're in the pranayama, you enter into a state of meditation, which is a powerful mediator of all the medications we need to control our chronic diseases. So let's start. Let's see what we incorporate in our daily lifestyle. As I said, as simpler than walking. So the first of all, so once we're up in the morning, you have all seen me how to do it. You sit down in a squatting pose. If you can sit down in a squatting pose, you can do with me. Sit down in squatting pose. You hold a glass of water and you keep the water overnight next to it and drink in a gulp. And throughout the whole day, generally, we wear one of these trackers. This is a very nice health tracker. And as you know today, this Apple Watch and all the trackers, they're a wonderful health tracker. So as I said, it's simpler than walking because you're able to sit down and able to get up without any support. Next, you listen to your body's signal. Be sure there is no pain during your asana practice. If you're sitting down like here, and if you're getting pain, you back off. You back off, you find a place where you don't have any pain. You may need to have a support initially. You may hold on to a chair or hold on to a wall to be in a posture. Stay in the posture. Next, you listen to your breath. Your breath has to be completely effortless. When your breath is completely effortless, you are having a powerful, remember, the relaxation response. The moment your breath is not effortless, if you cannot talk, if you're huffing and puffing, that is not a therapeutic yoga. Remember, very, very important. It is not a therapeutic yoga if you cannot talk, if you cannot sing, if you cannot breathe effortlessly. Next, from here, as simple as walking, I said. Also, remember, I will walk. I have a treadmill here. I'll walk on a treadmill, or I can walk outside. But when I'm walking, either in a treadmill or in outside, I'm always walking behind my breath. Means my breath is effortless and I can talk, I can even sing when I'm on the treadmill. I'm going to show it to you and show it to you how simple it is. As a daily lifestyle, in the morning, when you're standing up, just see if you can do this. You can cross your feet. Try it with me. If you can do it, it's a wonderful practice. Cross your feet. You can sit down, crossing your feet and getting up without any support. And also try it again in the opposite side, other side. Cross your feet, sit down comfortably, and get up without any support. It is being shown in studies after studies that if you are able to do this, you get a profound therapeutic effect in your body and mind. There is a lot of studies done which showed this is a marker of your cardiovascular health. And cardiovascular health, we said, is called endothelial health. If you're practicing with me, try this one. This is the next step. But remember, this is incorporating in your daily lifestyle. I even do this even when I'm in the morning, I'm in the bathroom. Because people ask me, how long do you do your yoga? I said, I'm doing yoga 24/7. So here I am, I'm sitting down comfortably and keeping my legs crossed. From here, I will give a try. I'll give a try to get up without a support. Try this. Sit down all the way to the ground. Sit down all the way to the ground. Sit down in the ground. Cross your feet. Take a little time. See how we can do it. Try this. Initially, you may have to put your hands in the front. Initially, you may have it, but once you can get it, it can happen. If you can do this, called a sit-rise test, it is a guaranteed antidote for any chronic lifestyle-related disorders. Once we do this in the morning, our Jalneti, called Neripat, will be able to do called a Kapalbhati Pranayama. After neti part, what we do, we bend our body, abdomen becomes softer. You do a Kapalbhati pranayama. Different posture. Head up, then you get the head down. Turn your head on this side. Other side. Then on the frontal sinuses. Very, very important practices. Somebody said they're having some problem with the sound. Let me just, give me a second. Hello? I'm sorry. Here it is. Okay, I'm back now. Hope the sound issue is over. So, in a day, as I said, it's simpler than walking, like what is happening. Now I'm sitting on this special stool, and you have seen it before. This is called your kneeling stool. Kneeling stool is a very, very important for yogic lifestyle, and you incorporate. This is a stool, you can see, it keeps your spine straight. When you sit down in a kneeling stool, your spine is always straight. So when your spine is straight, the muscles in the back start to relax and relaxation response sets in. Sitting in a chair, keep your spine straight. So what happens in a daily lifestyle is that sitting in a chair with your spine straight, whatever work you are doing sitting in a chair, but you take little time, close your eyes, touch your index finger and thumb, and pay attention to your breath. Simple breathing technique, which is the basis of pranayama, will help you to initiate that therapeutic part of yoga. So let's do it. You're sitting down with the spine straight, the hand touching index finger and thumb, Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Let's do it a few times. If you are doing with me, keep doing it. If you're interested in counting, you can count of 3 in, count of 6 out, count of 4 in, count of 8 out. We've been doing so long and so effortlessly, we can do easily count of 8 in, count of 16 out, even count of 10 in, count of 20 out. Close your eyes, keep your spine straight, hand in your meditation mudra. Let's do about 5 breaths. Breathing out longer than breathing in. When I'm doing it, I can easily feel my joints, my muscle tone, everything is slowly, easily getting melting away. When it melts away, we're sitting in a chair, especially most of the time we sit in front of, these days, we're sitting in front of our computer, in front of our iPads, and we are all connecting throughout the whole world, and we are all the meetings. And sitting here, what I do now, my abdominal musculature is little relaxed. I skip doing a very gentle and simple Kapalbhati pranayama. Eyes are closed, hands are in a mudra again. Continue this when sitting in a chair. You will see, and do it very slowly and gently, 1 per second, and you can continue all the mudras, which I have taught all the time, hand mudras, dhyana mudra or jnana mudra, index finger down, this is called a vayu mudra. It improves your vata-related disorders, improves pain, neuropsychiatric disorders. Shunya mudra improves your hearing. Prithvi mudra, it is a grounding, especially obesity, truncal obesity, diabetes. Varun mudra, to have a bladder function, to improve the fluid content of your body. Also, Kapalbhati pranayama, as we say, is a sign of your relaxation response. And it's not that you are doing, you are testing your relaxation with other relaxation practices. For example, I'm sitting here, what I do a prayer pose to the back. Put my hand to the back and do my prayer pose, put my hands together, and slowly my hand goes higher. Find the spot which we are doing, and I do it in front of the computer all the time. From here, I will incorporate my neck relaxation, like in the back and the front, in the side, right side, in the left side. Then I'll do all the way to the back, left and the right, then we rotate. Instead of breathing, and I have shown it to you before also, we do a lot of breathing technique, like we do breathe in, breathe out first. Take a deep breath in, slowly put your neck to the back, and breathe out, slowly put your neck in the front. Same way, you do breathe in and put your neck on the side. Listen to your body's signal, no pain, and an effortless breathing. Next, what you can do, the next one which I have shown you also before, that you breathe in with the sound of a Ujjayi pranayama. Ujjayi is constrict your larynx, breathe in, and breathe out with the sound of a bumblebee breathing, called Brahmari pranayama. So it will look like this. Breathe out first. So I'm already having some saliva in my mouth. Saliva in your mouth tells you you're having some activation of parasympathetic tone and a relaxation response. The other practice we do, and I also do it in front of computer, is that I'm doing a Kapalbhati pranayama, then I do the neck movement with my hand in a prayer pose to the back. Show you how easy it is, and it is a powerful activator of unblocking the inner healing power. You're doing Kapalbhati pranayama. Remember, I'm not doing the fact of Kapalbhati pranayama. Kapalbhati pranayama is telling me how relaxed I am and how much relaxation response I can set in. Let's do other three postures in the neck, doing same, spine straight, eyes closed, hand in the back as a prayer pose, and Kapalbhati pranayama with the neck movement. So incorporating Kapalbhati Pranayama with the neck movement, and what it does, the rotation of the neck compresses a blood vessel. It is called a vertebral artery. Vertebral artery supplies the lower part of the brain called cerebellum, and it creates a syndrome called vertebrovascular insufficiency with a altered sense of consciousness. In fact, this technique is being tried. I've seen in a lot of your say in rural areas. Give an example, a surprise. A dentist was doing a very rapid neck rotation for a person, and we do a very rapid neck rotation, and I'll show it to you a little later how to do it. They develop this altered sense of consciousness to the point it almost acts like an anesthetic, and this dentist is pulling out the teeth without any anesthesia. I have seen it. In fact, I just saw it even in the, no, I won't say I've seen it. I have heard about it. I've seen it in a live, obviously live, on what was that? On a news media. On media, a reporter went there and he or she was broadcasting live. So what they will do, and I do it also sitting in a chair, but be careful, do it very slowly and initially, and be sure there is no pain, and be sure you are able to do a complete effortless breathing. You'll be slowly rotating your neck. And you'll speed up. Don't do it if you have any symptoms. I said, in stages, impossible become possible, you'll be able to do it. And we all do it sitting down, we don't do it standing up, because it causes your altered sense of consciousness. You will feel like you're almost passing out. I've seen it being used in Chinese medicine. I've seen it being used in psychiatric therapy. I can feel it. My whole head is spinning. I'm just feeling like that I have an altered sense of consciousness, and the way to describe it, if you just drink an alcohol, if you drink a perfect amount, it will hit in your brain and you'll feel the effect of altered sense of consciousness. In fact, we always say a little bit of a drink, alcohol drink, is very good for your health, because it causes this altered sense of consciousness and activates an area called a limbic system, and it's called limbic system hypothalamus pituitary axis. Problem with the drinking is, when you feel good, you keep on drinking more and you get into more and more trouble. And also the human being, they always feel if one is good, 10 is better. So, see, it's very simply, actually have to do it initially very slowly and come to the point that you will be able to do it very rapidly and very fast. And I always hear this from the people. Oh, I was instructed to do it very slowly. I was instructed to do a very slow Kapalbhati Pranayam. I was instructed to do a very slow Bhastrika Pranayam. Yes, we're instructed to very slowly to start with. But once you keep on practicing, what happens? Your body develop this habit forming, what is called neuroplasticity. Then you're able to do it more and more. See, asana practice is very simple. Asana practice is very simple because only asana which is therapeutic in Sanskrit is called sthiram sukham asana. Stillness, happiness, and in a posture. Here I am. Here I am in a posture. I'm in a posture on my kneeling stool with my spine straight. I'm totally, there is no fasciculation. There is stillness in my body and my mind. I'm very happy. And I stay in the posture. Staying in the posture helps. In this posture also, I'm sitting here. I will do a little bumblebee breathing and Ujjayi Pranayama. Very, very important yoga practices. You do a standard Kapalbhati, you do a daily, a Bastrika Pranayama, like your bellows, Kapalbhati Pranayama, breath of fire, which is removing all the toxins from your body, alternate nostril breathing, activating both sides of the brain, but in a sitting posture, you do bumblebee breathing and Ujjayi Pranayama. Bumblebee breathing does, it shuts down all of your five senses. Then with the frequency, it connects with your brain. Two frequency interacts, cancels. So remember, I'm still in my daily lifestyle. I'm still in my daily lifestyle and I'm sitting in a chair, and in between all my Zoom performances, I hear from the people, oh, I had 6 Zoom meetings today. Oh, I'm talking to somebody in the office. Take a little break. In the break, you do this. So if you practice with me, let's do it again one more time. It's a very important practice. Put your index finger in the forehead. This is called a Shanmukhi Mudra, which you can close your, eyes and the nostril, and you can do your mouth. And put your thumb inside, close. The moment, the way you do it, you are closing your eyes, closing your ear, and closing your mouth. In the nostril, you can leave it open a little bit, so you can breathe out. You can breathe out through your nostril first. Take a deep breath in. Do it one more time. Breathe out through your nostril. Then the humming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take both the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, in front of the ear, inside the external ear canal. Look, this is activation of the auricular branch of vagus nerve. Bring the hand here, massage the neck in front, activating the carotid sinuses, which also activates your parasympathetic tone. In the back, you massage the insertion of two muscles, trapezius and sternocleidomastoid muscle, which are supplied by your cranial nerves. This is not part of your practice. If you're practicing in the morning or in the evening, it is good. But this is incorporating in your daily lifestyle. Generally, we say that you should practice in an empty stomach. And what is empty stomach we mean? We mean an empty stomach that don't practice after a full meal. People always ask me, I have to have a little medication in the morning, I have to have a cup of tea, I may have a couple of cookies or biscuits. Say, fine, this is absolutely not a problem. Problem is if you're practicing and if you have not fulfilled your mental requirements, then your mind will be always there. When you're closing your eyes, you will see a cup of coffee or a cookie in front of your eyes. Sitting down also, this is all we're doing in front of our computer. And with this chair, you can go back and forth. So it's not a big issue. You can go, because with the wheels in this chair, and most of the chairs, the office chair has a wheel. You do a sun salutation. It's a wonderful practice, sun salutation in a chair. Let's do it 2 sets of sun salutation in a chair and do with your breathing. Feet are totally grounded, the spine is straight, hand is in front. This is called pranamasa. Hands together and start breathing out. Breathe in, hand goes all the way to the back, and you start looking. And the best way to do it, do like this. Drop it down, keep both the index finger together and thumb together, like this. It's a very nice mudra, and also what it does, it guides you. It's very important, quieting down your mind. So breathing in, breathe in and goes all the way up. Breathe out, hand touching your feet. Hand goes all the way down into the feet. Let me show it to you all the way down so you'll be able to see. Your head was up here, Breathe out, hand goes all the way down into the feet. Head comes towards your body. From here, you do called Asya Sanchalanasana. Breathe in and hold on to your one knee. Pull it, take it up. Take the other foot in front and open your chest and look high up. Horse riding pose. Asya Sanchalana Asana. Put one foot here, take the other foot high up, and bring it up together. It's your called Parvatasana. Breathing out, slowly you put your body down in the ground, but here you do what is called your Ashtanga Namaskar. So bring your hands down slowly, put your one hand in the ground, other hand in the ground, you look high up and then put your head down. Basically, 8 parts of your body is touching. Forehead and your chest. 2. 2 hands. 4. 2 knees. 6. And 2 feet. 8. From here you get up and get into your Cobra pose, Bhujangasana. In a Cobra pose, you put your feet together and look all the way to the back, expanding your chest and looking high up. Breathing out. From there, breathing in, you get into your mountain pose or Parvatasana. Basically standing up, we start looking at your belly button. Breathe out. You get into Asya Sanchalanasana, a horse riding pose. One foot, bring your knee, bring your feet a little bit in the front. Chest opens up and look high up. Breathe in, you again get into your hand touching your feet, Padahastasana, hand goes all the way down into the ground and head comes towards your knees. Breathe out, hand goes all the way to the back again, put your index finger together, all the way to the back. And breathe in, hand comes into the front. So started with the breathing out and we ended up with the breathing in at 12 postures and sequentially with your breath. You can do the same thing on the opposite side and with opposite breathing. So let's do another set. Hands in the front. This time you breathe out first, then take a deep breath in. Breathe out, hand goes all the way high up. And breathe in, hand comes down like your hand touching your feet. Padahastasana. Because your Asya Sanchalanasana, you take your opposite knee, try to bring your knee close to you and push your foot away from you, open your chest and look high up. Horse riding pose or Asya Sanchalanasana. Then you go back into your Parvatasana or a mountain pose. Drop your head down. Try to look at your belly button. Breathe out, get into your Ashtanga Namaskar. Like in the ground, your hand goes way down here and you look a little higher up, then drop your head down, touch your forehead here. Breathe in, you get into a cobra pose, your hands on the side, chest opens up, and you look all the way to the back. From here you get into the horse riding pose in the opposite side, and this is your breathing out. Take your knee towards you, push your feet way high up there. Open your chest and look high up. From Asya Sanchalanasana, you get into your Parvatasana or mountain pose. Pose, you go back into your Padahastasana, hand touching to your feet on the ground. This is your breathing out. Breathing in, put your hands all the way to the back, hand raising pose or Hastuttanasana, and when you put your hands in the front in a Pranamasana. In between also, or sit down and do a little bit of a rapid Bastrika Pranayama. The way to do Bastrika Pranayama, a little rapidly, if you can do, remember again, the way to do it is that you keep doing slowly first. I hear it all the time, my teacher was teaching me to, yes, do it slowly, raise your hand up, put it down, but in a chair comfortably. Do your hand like a baby fist, put it here. Improves your lung function. So I'm still talking, still breathing, but my amount of air I can get in and out has increased maybe about 3, 4, 5 times. I can breathe out first, take a deep breath in. And breathe out. So, as I said, once you follow your breath, once you do all the activity behind your breath, and you incorporate it in your daily lifestyle, this is going on throughout the whole day. Yes, you have a lunch. Don't do anything after lunch. But a couple of people told me that after lunch they feel a little sleepy. Especially happens when you have a little bigger meal, call it a food coma. The physiology behind it is that after a meal, body rushes all the blood into your stomach, and when the blood goes into your stomach, there is a less blood going to your brain, and you feel a sense of sleepiness. At a full stomach, we don't ask you to do too many activities here, because basically what it needs your Kapalbhati Pranayam, abdominal lock called Uddiyani Bandh, and Agnisar Kriya. But instead, we do the right nostril breathing. Right nostril breathing is called sympathetic. Right nostril breath is called a heating. And right nostril breath, basically, it wakes you up. Remember the balance. Alternate nostril breathing is a balance. So let's start doing a little alternate nostril breathing, and we'll show you how to do the only right nostril breathing. In alternate nostril breathing, with the left hand, you touch your index finger and thumb, put it on the left knee. Right hand, close your right nostril. You don't have to close all the way down, just close it underneath your nasal opening. So breathe out through your left nostril. Take a deep breath in through your left nostril. Drop your hands down, close your left nostril with the ring finger and little finger, and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Keep doing the alternate nostril breathing. Then slowly put your index finger and middle finger in between your eyebrows and bring your focus on the eyebrows and do the alternate nostril breathing. Also the left hand, hold on to your right earlobe. It activates the opposite side of the brain and brings what is called a super brain yoga. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is cooling. Right brain is female. Left nostril breathing is called Ida. Cooling, parasympathetic response. Right nostril is controlled by the left brain. Left brain is heating. Left brain is sympathetic. Left nostril breathing or right nostril breathing is called your sympathetic and heating. Before you do a breathing through one nostril, as I said, right nostril breathing is heating, sympathetic. Left nostril breathing is cooling, parasympathetic. You test the patency of your nostril, and always remember, one side of your nostril is more open than the other side, and that cycle repeats between 90 to 120 minutes. So what you do, close one nostril. I'm closing my right nostril. I'm doing Kapalbhati pranayam for the left nostril to see the patency of the left nostril. Left nostril is wide open. Test on your right nostril now. Both sides almost equally open. As I said, we do your neti part or jalneti in the morning, so get some drainage comes out, You also have a little bit of a coughing because when you do the deep breath in, it touches the back of your throat. Like when you're doing it, closing your eyes. And if you get a little bit of a cough at the time, it's entirely normal. In fact, bigger and longer you have, remember, lung has 90% reserve. That's what you use to fight the COVID-19. When you even inflate, when you don't, if you can do a chest breathing, it's always better than your chest and abdominal breathing. And I'll show it to you just now. In a right nostril breathing, what you do, you close your left nostril, breathe in and breathe out your right nostril. This also will warm you up. If you're feeling cold, if you're feeling a little bit of drowsiness after a meal, you can do a right nostril breathing. It does not have any effect if your stomach is full. A practice, daily practice, we do an empty stomach in the morning, that is granted, but these are the practices we are doing when we are doing our daily work and incorporating in our daily lifestyle. You also can do the right nostril breathing. Breathe out first, breathe in through right nostril, breathe out through left nostril. Instead of doing opposite again, breathe in through the right nostril, breathe out through left nostril. So it will look like this. Breathe in through the right nostril, breathe out through left nostril. Breathe in through your right nostril, breathe out through your left nostril. So these are the practices you incorporate. So the practice you will do, the Ujjayi Pranayam, which is so relaxing, your stomach will go in, abdominal wall will go in, it's called your abdominal lock. Then you use the chin lock, Jalandhar Bandha, and use your left nostril breathing. All relaxing, cooling, just sitting in a chair, incorporating in your daily life. Hands in an Adhi Mudra or baby fist, Balu Mushti Mudra. You like to do the thoracic breathing. Abdominal breathing is coming, cooling. You'll say baby. Baby does abdominal breathing. So if you had to test your abdominal breathing, what you will do, say you put your hand here and slowly bring your touch your middle finger at the level of the belly button and take a look at it, what will happen. When I'm breathing in the lower part of the lung, it pushes the diaphragm, opens the abdomen, and abdominal wall will rise. But if you're doing abdominal breathing and if you see your chest expanding, your chest is not going to expand. So if I'm doing it, like I'm doing abdominal breathing, abdominal wall going high up, abdominal wall going down. Now I tightens up the abdominal wall. I don't want the abdominal wall to come out. And if I do a thoracic breathing, and you will see what will happen in thoracic breathing. Now abdominal wall is tight. So to finish and giving an idea that what you incorporate in the daily, even in exercise. Remember, people always ask, I'm exercising. Why do you have to do yoga? Exercise is a muscle contraction. You contract your muscle. Exercise is a sympathetic overdrive. It raises your heart rate, raises your blood pressure, raises your respiratory rate. It is like called a fight and flight response. Your muscle tightens up, blood sugar goes high up, and when the sympathetic response goes way high up, the body activates our parasympathetic tone to balance, so we get a parasympathetic activation. So the exercise is a sympathetic overdrive followed by parasympathetic activation. You do not pay too much attention on your breath in exercise. So what you're doing, you are huffing and puffing, you are creating maybe a state of hypoxia, low oxygen in the blood. But then hypoxia is good. Hypoxia stimulates. Hypoxia is good for building your strength and stamina. No question about that. But in a yoga practice is your relaxation response. The muscle relaxes. You do not cross the limit of your pain. Because pain tells you that you are creating an imbalance in your ligaments, muscles, joints, bones, and the rest of your body. Follow your breath. Be sure your breath is completely effortless. So if you incorporate both, and incorporate your daily lifestyle, see how wonderful practice is going to be. I do a daily practice of yoga, but also every other day I do a little weight training, I do a little treadmill, that is for my cardiovascular function, but that also I incorporate the principles of yoga. So how do I do it? Let me show it to you one time. So when I will be doing a weight training, if I am doing my biceps curl, I pay attention to my breath and do it slowly and get the therapeutic effect of the exercise. Remember, exercise is also therapeutic because it activates your sympathetic nervous system followed by parasympathetic tone. But in the activation of sympathetic nervous system, you get a lot of crisis, a lot of accidents. We see, I'm in the YMCA and somebody is doing a push-ups or a weight training, big, and they get into a heart attack. Or somebody is running a marathon, at the end of marathon. Okay. So here I am, if I'm doing my biceps, what will do? Muscle needs oxygen when it's contracting. So I breathe out first, I take a deep breath in, breathe out and do slowly my breathe in, breathe out, breathe in, breathe out. Same thing I'll do on the other side. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Same way, my breathing is essentially normal. I do both sides. When I do both sides, breathe out first, breathe in, breathe out. It doesn't have to be a too heavy weight because the weight will come to you. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. So once you follow this principle, what happens? You get a pure therapeutic effect of both of your exercises and the yoga simultaneously and together. That's what I was saying. It is simpler than walking. If you're going to do your triceps, see, I will also do it in graduated. I will start with this. I do about a rep. Then I'll go to the next high up. I'll do 3 sets. So I'll set, if I do a triceps down, the same way it will be. It's the same concept. Muscle needs oxygen when it's working. So breathe out, take a deep breath in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. So follow this. Same way, if I'm even on my bench press, if I'm in my bench, I'll be doing the same thing. There will be no difference. So, example will be, if I can show it to you one time, that's what we say. you do both at the same time. So here, when you will be on your bench and you'll follow the same breathing technique. If you do the same breathing technique, breathe out first, deep breath in, breathe out. Breathe in, breathe out. And you do a certain amount of, you can go 20, 30 counts in a lower way, and you keep going higher. Before you get up, you do also a relaxation technique. The way to relaxation, put your hands behind, clasp your hand, breathe out and breathe in. Breathe out longer than breathing in. After about 5 or 10 breaths, take your hands back again, take it all the way to the back, and keep it relaxed. All in your relaxation response. You can always do it. This is called modified knee chest position, Pavan Muktasana. Slowly it will feet your drop drops down in the ground, and you are in a profound relaxation response. Then when you get up from here, look at again how you incorporate all the yogic maneuvers here. Slowly bring it down, put your head down, the supported forward bend. Your whole body is straight, head is, you can even put your hands on this side, and slowly get up. You get a wonderful relaxation response during even your weight training. Same thing will happen to your treadmill, and let me show it to you. Let me get into treadmill and I'll show it to you what I'm talking about, your breathing and the effect. So here you are in a treadmill. When you start your treadmill, you start with a very lower speed. When you start with a lower speed, you may not hear my voice because of its sound, but here I will start, say, at 2.5 miles per hour. Then I'll go to slowly go to 3, 3.5, 4, but I'm following my breath. My breath will be completely effortless. So if I start slowly, and once I start, I'm following my breath. I am not going to cross my breath. Here I am at 2.5, and my breath essentially is normal. So just to show you a sample, I'm going to do it for about say 20 minutes to half an hour, 2.5. When I'm comfortable in 2.5, I'll go up to 3. This is I'm at 3 miles per hour. But my breath is normal, I'm talking, I'm breathing, I'm singing, I'm essentially normal. Once I cross this 3, and generally we do 5 minutes at one pace, and if you go high up, you go high up to here I'm 3.5. 3.5 miles per hour, I'm still talking, I'm breathing, and I'll be here at least for 5 minutes. Once I complete with my breathing, then I will slow down. I'm not going to stop all of a sudden. I'm going to slow it down to say I'm 3 miles per hour now, and I'll be doing it for about a minute and a half or 2 minutes. I'll come down to 2.5. I'll do a minute or 2 minutes, and slowly I'm going to go ahead and stop it. So these are the techniques that, as I said, it is really a yoga practice is simpler than even walking. If you want to go walk outside, do a walk same way with yogic principles. And when you do the yogic principles, you will be getting all the therapeutic benefits, which is the, in essence, yoga as a therapy. Please continue. All the practices what we have done, we do the same thing in our daily practices. Is nothing new. Just incorporate in your daily lifestyle. Incorporate daily lifestyle, you will have a wonderful, a therapeutic outcome from yoga practice. You'll enjoy a quality life, enjoy a disease-free, most important is medication-free, and enjoy a quality life, which is called a strong digestion, easy elimination, and good night, dreamless sleep. Thank you again for your participation. We'll be here almost every Saturday, except this month I have two very important presentations. I'm doing a presentation for Texas Medical Association. This is for all the physicians group. It's very large. Remember Texas, that was the largest state, one of the largest states after California. So the topic is going to be yoga therapy for post-COVID syndrome. Very important. It's called a long hauler syndrome or post-COVID-19 syndrome. What is yoga therapy can offer? The fourth weekend of this month, this will be the third weekend, fourth weekend, I will be presenting our continuing medical education for our physicians and healthcare providers. We have all the registrants. Looks like almost half of them are physicians and half of them are healthcare providers. So I may miss some Saturdays. Let me see what timing I have to present. If the timing clashes, we'll go ahead, cancel the class and do it again next time. Thank you again. Hopefully see you next Saturday.